Namaste. Good afternoon. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. In my pursuit to address, promote, propagate Ayurveda and psychotherapy, every week I come up with discussions on either Ayurveda psychotherapy and Ayurveda psychiatry and mental health disorders, modern psychotherapy techniques, and related aspects. So, people, whenever they ask me to talk on any mental health disorder, they ask me to talk about the medications, what can be taken. So, I just wanted to give a brief about myself. See, I follow mostly non-pharmacological approach. That is 95% of what I do does not involve any medications. So, and also in psychotherapy and in in mental health disorders, the main thing which is needed is talk therapy or any form of psychotherapy. That means talking and taking counseling. Either it could be cognitive behavioral therapy or other talk therapies, psychodynamic psychotherapy, psychoanalytic therapies, and dialectal behavior therapies. There are so many therapies which are practiced for individual, different set of mental health disorders, different therapies for different of them, and individually also it is customizable. So I don't, prescribe any mostly I do not prescribe any medications. So, if you are coming for any medications of that sort, then if you need any medications, if the intensity is very high, then you have to approach I feel you can directly approach a psychiatrist. We are psychotherapists and we don't basically prescribe meds. Yes, I do prescribe Ayurvedic herbo mineral preparations at times that only 5% of what I do is on meds, and maybe Panchakarma. I refer to Panchakarma sometimes when people need purification or detoxification. Here, detoxification does not mean the fancy detoxification detox plans. This detoxification is authentic Ayurvedic Panchakarma. We cannot, completely give it a term. So that term we use is either purificatory panchakarma or detox or the detox. So that is it. And people ask me, I got a question from a viewer that why do I do these kind of videos instead of sharing some tips or tricks. See, I talk on the aspects like on full detail of every mental health disorder because I want people to be more informed of the disease. If you are more informed, whether it is a physical health disorder or a mental health disorder, if a person is more informed, then what happens is the decision taking will be good. You will approach a correct person for your problem. So to make people informed and to remove the mental health stigma, I am doing this videos instead of doing some tips and tricks. So this I know this channel's aim is not to give any tips and tricks on any disorder. No, we are not doing that. Instead, I don't want people to be misinformed of any disorder or any mental health condition being misrepresented or misinterpreted. So I am doing it in a detailed way so that people can understand it, and then they might take an informed a decision because you know about the condition. Now you can go ahead for your you can take an informed decision. either for yourself or your family member. So I know videos are a bit lengthier. My videos seem to be a bit lengthier, but it is for you if you have a learning mindset, or if you want to know about the disease in detail or the disorder in detail, then you can watch the video. And if you feel the audio is a bit slow, you can just take it to 1.25 or 1.5x, so that you can it is easy for you to, it will complete faster, So, today's topic of discussion is the continuation of post traumatic stress disorder. You can see in my background that it is showing that psychotherapy is the most common method of treatment for post traumatic stress disorder. So, we are going to talk about the detailed management of post traumatic stress disorder today with, the case studies. So, how do we manage with example case studies? What are the forms? And if you want to know in detail about what is post traumatic stress disorder, please refer to my last video. I'll give the links in the description, and you can just go watch that video and then come back to this for the treatment. So let's get started. And one more thing before starting the video, I wanted to give some information. If there are any mental health professionals or Ayurvedic professionals who are into Ayurvedic psychiatry or Ayurvedic psychotherapy or Ayurvedic neuropsychiatry, I invite you professionals, if you have any research, or if you have any treatment modalities that have been successful for the patients, for your clients, and if you want to discuss it here with us, you can just DM me, and you can just or you can message me in the comment section in the YouTube or LinkedIn, wherever, and or you can direct message me on LinkedIn. So if you want to come and discuss here of your expertise and of your success, because my motto is to promote Ayurveda and psychotherapy globally, I would want to invite professionals for one or two episode collaborations, so that we can share our successes together, and we can talk about it, so that we can make people more informed about it. So I invite all the professionals, mental health professionals, either from the Ayurveda or from any other fields, or they are a psychotherapist or successful psychiatrist, to be on my program and to give us their insights on their expertise. So this was the message. So thank you. I welcome all the, I will welcome all the requests, and we will then decide how to go about it. So thank you. So now let's come to the topic, that is PTSD. Let's get started without wasting any time. So, see, PTSD we have discussed in the last session itself. See, to give a recap, post traumatic stress disorder is a mental health condition that's triggered by terrifying event, either experiencing it or witnessing it. Either they might have experienced a terrifying event, or they might have witnessed it. Okay, symptoms may include flashbacks, nightmares, severe anxiety, as well as uncontrollable thoughts about the event. So, post traumatic stress disorder is a mental health problem you may develop or often experiencing traumatic events. So, and see, it develops in some people who have experienced a shocking, scary, or dangerous event. So, we have discussed it in detail in the last session. So, what we are focusing on is psychotherapy today. What we do, the main thing is what is done is cognitive behavioral therapy. say 60 to 70% of the cases find cognitive behavioral therapy, they are relieved by the symptoms of the trauma, and they are treated, almost they're treated by cognitive behavioral therapy. But somehow different individuals may require some other types of talk therapies as well. 30% of the population may require a cognitive behavioral therapy, might not be so beneficial. They might require other talk therapies as well. So, and then see, the CBT is cognitive behavioral therapy. See, cognition, you can just take that it is the both the cognition and the behavior. So, CBT focuses on identifying and changing negative thought patterns and behaviors related to the traumatic event. See, CBT in general, if you want any information on that, I have two videos on cognitive behavioral therapy as well. You can go and check out those videos as well to get more detailed information. Here, in the case of post traumatic stress disorder, CBT focuses on identifying and changing negative thought patterns. Basically, what cognitive behavioral therapy is, it helps in changing the negative thought patterns and the negative behaviors related to the traumatic event into the positive thought patterns and the positive behavioral outcomes. So, exposure therapy. Exposure therapy is a therapy under which comes under CBT. So it involves gradual exposure to the trauma related thoughts and situations in a safe and controlled manner. I'll give you case studies below in the session itself, so that you can understand what happens, exactly. These are the hypothetical case studies. So, see, psychotherapy is, we call psychotherapy as talk therapy. Basically, psychotherapy means talking. A client is, telling or expressing all his concerns to the psychotherapist, and they, and receiving after, once the psychotherapist gets to know all the condition, he or she gets to know the information, then what happens is the counseling starts. The psychotherapist makes a plan of what all can be done, and then starts. And in some cases, the 10 to 15% of the relief, the first client is relieved only by expressing. It is not only for the post traumatic stress disorder, but or the trauma induced stress, but for every mental health disorder, when the person starts expressing or sharing his feelings, his thoughts with the therapist or with the mental health professional, he starts finding relief in his symptoms. That also happens. When you share your things, that's why in psychotherapy also it is said that you make, I have talked about this n number of times, you make a support group. That means the people who you trust, who you can trust blindly, like your family members, your closest family members, your siblings, your friends, your spouse, or your children, whoever is the very closest circuit which is close to you. So that what happens is, when you share or when you communicate your concerns, the problems, start reducing. And when you communicate these to your mental health professional, it really helps you to calm down, and they give you the strategies to deal with the problem. So, and what it does, see here, psychotherapy in here, it aims to help individuals to understand and process their traumatic experiences. First, to understand and accept that you have experienced a traumatic experience. So you have had experienced a terrifying event or a traumatic event, and you learn to process that, and you learn to manage that and manage your symptoms, and develop effective effective coping strategies. The thing is, it is not a one day process. When we say about this, you require multiple sessions of this, or multiple months, maybe 3 to 6 months of treatment, or maybe more in individuals, depending on the intensity, because the intensity also matters. So, and what we can do, what all psychotherapies can be done is, again, as I said, see, CBT, cognitive behavioral therapy, is one of the most widely used and researched therapies for post traumatic stress disorder. It focuses on identifying and changing negative thought patterns and behaviors associated with the traumatic event. And there are two main approaches. What are the approaches? Is cognitive processing therapy. We call it CPT. CPT helps individuals challenge and reframe distorted beliefs and about the trauma and its consequences. See, what happens is, cognitive processing therapy. What it does, it individuals, it helps the clients to challenge and reframe distorted beliefs about the trauma and its consequences. What happens in PTSD, after they experience trauma, they have that in mind that this will happen again. They become hyper vigilant. If you remember that we have discussed this in the last session, that the person becomes hyper vigilant. He's always terrified. He or she is always terrified or worried that what this might repeat, the incident might repeat. So what we do here is we challenge those beliefs. Matlab, we differentiate it, whether the fear or the constant fear or the anxiety for this is realistic or unrealistic. So if it is unrealistic, we challenge it. It aims to modify negative thoughts that contribute to emotional distress and avoidance behaviors. So it does that. It challenges. And next, what we do is exposure therapy. So prolonged exposure therapy here. See, what it does is gradually exposing individuals to memories and situations. Yes, we remind them of the memories and situations so that they could accept and process that this has already happened. This exposure helps reduce the anxiety and avoidance associated with those triggers. And in some cases, what happens is, initially when you expose them, it will be a lot of stress to them. Like, they have to go through that incident. If that is a client of witnessing a crime or a murder, or the client has himself or herself undergone any sexual violence or physical violence, then what happens is, it becomes difficult for them to initially, it becomes difficult for them. We have coping strategies for them as well. We take it up slowly in that cases, and what we do is we add other talk therapies as well. So next is here is next important therapy we practice is called EMDR, that is eye movement desensitization and reprocessing. So this is the main technique when it comes to post-traumatic stress disorder. So what it does is, it means eye movement desensitization and reprocessing. That means EMDR involves guided eye movements or other forms of bilateral stimulation. So while recalling the traumatic memory, this process helps desensitize the emotional change associated with the memory, and allows individuals to reprocess in a more adaptive way. That means, what better can be done in that situation, even if that situation happens again. That means, see, this is usually guided eye movements or other forms of stimulated bilateral stimulation. While you recall that memory, you do some eye movements, or some techniques are taught to them. This, what it does is, this process helps desensitize the emotional charge, to bring down that grief and to desensitize the associated, the that associated with the memory of that incident and allows individuals to reprocess. Everything here is, taking out of the mental clutter and reprocessing it and bringing back the mental clarity and emotional regulation. So this, and as I said, we use other types of therapy here as well. That is, we call it as dialectal behavioral therapy. So DBT is particularly useful for individuals with complex PTSD. There is something called, simple PTSD and complex PTSD. I will talk about it also. What is simple and what is complex? So with complex, as I said, when the things are not, manageable by the cognitive behavioral therapy, we use dialectal behavioral therapy. That is with complex PTSD who struggle with emotional dysregulation or who have the tendency. Basically, complex means the intensity is high. That means they are not only they are trying to self harm, or they have severe relationship or severe difficulties that will interfere in their life. You have to understand that the intensity is severe in this case. So it combines cognitive behavioral techniques with mindfulness practices to teach. There are some mindfulness practices involved in every mental health disorder. In every situation, we teach some mindfulness practices to them. What it does is it helps in emotional regulation, interpersonal effectiveness, and distress tolerance and self acceptance. Narrative exposure therapy, NET. NET is often used for individuals with a history of repeated or prolonged trauma, such as refugees or survivors of ongoing abuse. It involves constructing a chronological narrative of the traumatic events to help integrate them into the person's life history. Because there is something called narrative exposure therapy. So, what it is as I said, exposure therapy is exposing to that situation gradually, and this here is chronologically, constructing a chronological narrative of the traumatic events, bringing back that events उनके सामने फिर से वो सब क्रिएट करना जो हुआ है, just to sometimes it may create more pain, but in the long term it helps in the relief. It helps in the relief. So doing all that, this is useful in survivors of ongoing abuse. If there is an ongoing abuse, what it does is it involves a constructing of a chronological narrative of the traumatic events to help integrate them into the person's life story, to accept and process, to understand, accept and process that terrifying event which has happened in their life. We do this narrative exposure therapy. And as I said, we also have some mindfulness based therapies. Mindfulness based cognitive therapy. What is this is we give some cognitive exercises. They include journaling as well, and keeping account of your emotions, taking responsibility for your emotional behaviors, everything. All these are and what it does, it helps individuals become more aware of their thoughts. They become more aware of their emotions, and they become more aware of their bodily sensations. These therapies can reduce reactivity to triggers. Then they're not easily reactive to the triggers, and it also promotes emotional regulation. Though it is gradual process, but it promotes emotional regulation. Next is the group therapy. See, group therapy here, I've talked about the group therapy n number of times. See, group therapy here is a supportive environment where individuals with PTSD, that means in any kind of group therapy, you will have the clients with the same ailments, and you can share your thoughts, you can share your experiences, the communication, and learn from others. Others can learn from you, and practice interpersonal skills, practice coping strategies together, because in each mental health condition the symptoms are different. What they are going through, the trauma might be different. Here in the post traumatic stress disorder, the trauma you are facing and the trauma that person is facing may be different, or it may be same, which both helps you to learn from each other, share your experiences, be together in your treatment journey. So it can be especially helpful in reducing feelings of isolation and promoting a sense of community. Here to promote a sense of community. So, here the choice of psychotherapy depends on the individual specific symptoms, preferences, and treatment goals. They are different for different. This is customizable. Some individuals may benefit from a combination of different therapies, and while others may respond best to a single approach. So, the therapeutic relationships and collaboration between the therapist and the individual are also crucial factors in the effectiveness of the PTSD, psychotherapy in post-traumatic stress disorder. See, all these are the and avoidance as education and psychoeducation. See, whenever you have an ailment or your family member has a mental health ailment, you always, it is better to know about the condition, whether it is PTSD or anxiety or stress, whatever it is, but you have to learn about the through original sources. Learning about PTSD, its symptoms, its effects can empower individuals to better understand their experiences and take an effective role in the recovery. So what it does is, you can make better decisions. You can approach a right person. You can get right information. You will not be misinformed, or that things will not be misinterpreted. So it helps actively in the recovery. And mind body therapies like yoga, meditation, exercise, developing hobbies, skill upgradations, all this is for regular and same for all the mental health conditions. These some of these are same for similar for all the mental health conditions. And trauma informed care, see here what we do is healthcare providers, therapists, caregivers who are trained in trauma care can create a safe and supportive environment that respects the individual's experiences and promotes healing. See, what happens is in trauma induced stress, there may be physical ailments as well. The person might have undergone physical abuse, he might have physical marks, physical wounds. So, all the therapists and the healthcare providers should collectively, help in treatment, or the, sexual violence survivors, or the survivors of any hazards, or any volcano or any earthquake or any hurricane, all those biohazards, or there are different kinds, or for army veterans, war veterans. So the trauma informed care is they need both the physical health support and the mental health support. So trauma informed care is you go to a hospital or a setup where you have everything all in one, so that you can have everything. Okay, some case studies. We'll see some of the hypothetical case studies, so that what happens is you'll get to know that what how an idea that how the treatment goes and what is the outcome of it. So what happens is the first thing we are taking is military related PTSD. So I had said, if you could remember if you could have seen in the last session, I said that I had mentioned that the PTSD was first found in the disease was first learned because they had seen the disease first in the war veterans, in the army veterans. So here we are taking a case of military related PTSD. See, what happens is we'll take a person called Apple. So Apple is a combat veteran who served in a high intensity combat zone. He experiences intense nightmares and flashbacks of the traumatic events he witnessed during his deployment. He avoids crowds and loud noises and becomes easily irritable and angry. What happens is, एप्पल एक कॉम्बैट वेटरन है, एक आर्मी वेटरन है, एक वॉर वेटरन है, जिसने हाई इंटेंसिटी कॉम्बैट जोन में, जहाँ पे बॉम्बिंग होती है, जहाँ पे वॉर के लिए फाइट किया जाता है, वहां पे उसने काम किया है. So he experiences intense nightmares and flashbacks of the traumatic events. He has experienced some of his, colleagues or the officers working with him die in the war zone. So in front of his eyes, he has witnessed all of those. So he has witnessed all of those, and what happens is he always gets that flashbacks of the event, of the terrifying event, and of that traumatic event. He gets the nightmares, and it is difficult for him to work now. And what happens is he starts avoiding crowd, he starts avoiding loud noises, he starts avoiding, he resigns his work, he likes to be isolated and becomes easily irritable and angry. All these symptoms Apple has because of the traumatic trauma he has experienced in the war zone. So what happens is this person Apple seeks therapy. So this person seeks therapy from a mental health professional who specializes in trauma. You have to see while you that if the person is specialized in trauma care or not, trauma post traumatic stress disorder or not. When you are having this specific disorder, he undergoes cognitive behavioral therapy, as I said, and exposure therapy. And what it does is it addresses his intrusive thoughts and desensitizes him to his triggers. So his therapists help him challenge and reframe negative beliefs he has developed about the world. So what it does is first understanding, accepting, processing the traumatic event, what all can, and what happens is replacing the negative thoughts about the thing is, and doing the positive, converting into positive thoughts. That is called cognitive restructuring, seeing whether his fears are really realistic or not. We do several exercises and mindfulness practices to come out of this. Of course, this requires time. And what happens is, after all that, the outcome is after several months of therapy, Apple's nightmares and flashbacks decreases. He is now able to, go and socialize, and he is now able to. His angriness, his irritability is reduced. All his symptoms, and he resumes his work. So, and now he can do his work. He starts doing his, continuing his job, and his relationships are also becoming normal. So, this is the outcome. And as I said, it will take several months of therapy because this involves physical therapy and psychological therapy, and this will take several months. The next what it does is he learns effective coping strategies to manage his irritability and anger. With continued therapy and support, he gradually becomes more comfortable in, as I said, in public places, in loud environments, and he resumes work. So this is what happens. And another case study for survival of, here we talked about a combat veteran. Now we are talking about the survivor of sexual assault in the PTSD. See, Peahen. Let's take Peahen. Peahen is a survivor of a sexual assault that occurred a year ago. Even though it has occurred a year ago, now she experiences intense anxiety. She has trouble sleeping. She has constant fear, constant stress, and the flashbacks and nightmare of her assault, disturbing her sleep and avoiding situations, avoiding socializing, avoiding going to the crowd. And there are some memories which makes her, reminds her of that event. And what happens is she often feels numb and disconnected from her emotions, and she becomes irritable, and she isolates herself. So all these happens. Then what she does is she approaches a therapist, so trauma informed therapist. So she undergoes eye movement desensitization and reprocessing. So I said that through eye movement desensitization and reprocessing technique, what she does is she is processing her traumatic memories and reduce her emotional distress. So, and what happens is her therapist also uses CBT techniques, other mindfulness practices to address her negative thoughts and anxiety. So, what happens is after several months of therapy, Peahen's anxiety decreases and her sleep improves. She gains a better sense of control over her emotions, and the unrealistic fears comes down, and she feels more connected to herself. While still she has some triggers, yes, still, in some months, in a month or two, she has some triggers, but she now knows some coping strategies to manage her, triggers, to manage her reactions, and engage in activity once she avoided. So this is a, brief of how can, in this situation also it can be treated. And I'll give you one more example of childhood abuse related PTSD. We are taking different case studies because, to understand how it works differently in different conditions for different people, right? So here we'll consider this person as Strawberry. Strawberry experiences severe physical abuse during her childhood. She had experienced physical abuse during her childhood. Maybe it is because of her family, or it is because of the outsiders, we don't know here. And what is her problem is she struggles with intense feelings of shame, guilt, and she always self blames. She thinks that she is not worthy of love, and she avoids, all the intimate relationships and has difficulty regulating her emotions. She isolates herself. She cannot talk to people. She cannot trust people anymore, and that too for, intimate relationships. So what happens is her confidence comes down, the self-esteem comes down. So because of this, though this has happened in her childhood, but this is affecting her in her adulthood. So treatment is, then what happens is this Strawberry starts taking therapy with a trauma focused therapist who uses cognitive processing therapy. I talked about CBT to address her feelings, her negative beliefs, and emotions related to the abuse. Then she also participates in group therapy with others who have experienced childhood trauma to gain support and share experiences. This is a huge help when a person participates in a group therapy. And her therapist introduces mindfulness techniques to help her regulate her emotions. By different types of therapies, after several months of therapy, Strawberry's self-esteem improves. She starts to gain confidence. Her intense shame and guilt decreases because she gets to know that all those are unrealistic. She starts to love herself. She starts to take care of herself. So she start forming healthier, relationships. She begins to start trust in people and opening up to her close friends about her experiences. So she starts sharing and communication with her trust group. Okay, then what happens is she continues to work and managing on her emotions. While the memory, see, it is not that once you take psychotherapy, the memories cannot trigger. The memories might trigger, but now you have the coping strategies to manage your emotions. To be productive and to eat and to not let the triggers impact your daily life. What happens is, in any of the mental health condition, the daily life, the daily routine is impacted. So the productivity is hampered. The work may be hampered, the relationships may be hampered. All those comes down. So these are some examples of how post-traumatic stress disorder is treated in brief, so that you get an idea of how it is, done. So I think we will end the session today. I'll come up with another topic in the next session. And thank you for staying tuned. If you want to come and talk on my show about your expertises and about your successful treatments of mental health disorders, you're welcome. And thank you and namaste.